As you heard from Dr. Walensky, the Delta variant is assuming more and more dominance in this country, particularly in those areas of low vaccination. So the logical question one asks is that the vaccines that we are using, how effective are they against the various aspects of disease associated with the Delta variant? If I could have the first slide. First, let's take a look at the mRNA vaccines, which are 2 out of the 3 vaccines that are used in this country, and mRNA overwhelmingly used the most among vaccines. The real world setting, as shown here, if you ask cases protected against, a Scotland study showing that 2 doses of Pfizer are about 79% protective. Symptomatic disease, a study from England, again, 2 doses of Pfizer, 88%. And hospitalizations, again in England, 2 doses, 96% real world effectiveness. You can make a quite reasonable assumption that data that are applicable to Pfizer are also applicable to Moderna. Then the next slide, please. The question is, I've just spoken about the mRNA vaccines. What about the J&J vaccines? There's indirect and direct evidence for effectiveness of J&J against the Delta variant. Because if you look at a comparison between the J&J and the Oxford AstraZeneca or the AZ vaccine, because they use similar adenovirus vectors, we have clinical data with AZ in real world effectiveness. And as you can see, when you look at infection versus symptomatic versus the important number on the bottom of the slide, 92% effective against hospitalization from the Delta variant. Next slide. But there's also other types of data, namely looking at the antibodies that are induced by vaccination with J&J. A recent study that came out a few days ago looked at the blood studies from individuals vaccinated with the typical single dose of J&J vaccine, and it covered the Delta variants and other variants really effectively quite well. Next slide. In a similar related paper, when you look at the durability of the humoral cellular immunity using the J&J vaccine, again, against the Delta and other variants, again, shows not only good protection projected by the antibody test, but also a good durability of that protection out to 8 months. So what's the bottom line of all of this? We've heard about the threat from Dr. Walensky about the increasing in infections. The question is, if you get vaccinated, are you protected? And the answer is, next slide, as shown on this story from the New York Times, the world is understandably worried about the Delta virus variant. But studies showed, as I've showed you on the previous 4 or 5 slides, that the vaccines indeed are effective against it. The only conclusion one can reasonably come to from looking what I've told you over the last few minutes is, please get vaccinated. It will protect you against the surging of the Delta variant. Let me now hand it over